Hello, 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 everybody. I hope everyone is well today. Sorry for 1 second. I gotta reverse my camera. No. How do you reverse this shit? Click, click. There we go. There we go. Hello, TikTok. Hello, hello, hello. Hello, hello. Security Tales. What's the word, nerds? What is going on, everyone? Thank you so much. Thank you so much. Today, I had made a statement that we won't be doing it live on Facebook, but we will be on Instagram with Dr. Huang's Instagram today. And then
I'm on my TikTok.
Oh, I'm sorry. She's on her TikTok today. So hello to Dr. Huang's TikTok. Hello, hello, hello. So everyone, first of all, I want to say hello. And Dr. Huang, please go ahead and introduce yourself.
Hi, I'm Dr. Wynne Huang. I'm a primary care physician in Winchester MediSpa with a special focus on hormones. And I also have a MediSpa diet. So yeah, I'm sorry, I'm a little disheveled. I just came from playing pickleball with the elders.
Okay, good job.
So
Good
my hair's
job.
a little bit of a mess, so I apologize.
All right. There's no apologies. There's no apologies. So welcome aboard, Dr. Huang, as always, as always. So just going to start right out. So first of all, thank you so much for joining us today. And for the ones that are basically starting to get on to join us, thank you, thank you. So first of all, I want to say welcome back to Security Tales. I'm your host, Filipe Monteiro. And today I've got a very special guest, my wife, Dr. Wynne Huang. She's here to talk about something that affects millions and millions of women.
And men.
But okay, I didn't know men get menopause, but okay.
They have to deal with the symptoms.
Oh, okay. So millions of women, but doesn't get nearly enough attention. Hormones, menopause, and how to take control of your health. So, Dr. Huang, they say menopause is like puberty revenge, just with better credit and worse sleep. So buckle up. We're going in.
I never heard that.
Well, I thought it was kind of funny. So,
do you need to fix your TikTok?
no.
Oh, okay.
It's on.
Oh, okay.
Yeah. So I'm gonna start off by just saying, and I'm also gonna jump into some supplement and lifestyle side, things like creatine, protein, and vitamins that can make a huge difference. So let's just dive in right now. Hello, Cece. Hello, hello, hello. How are you? Cece's talking about education of the patient is crucial. Crucial. Where are you seeing critical?
I can't see. I don't know.
Oh, okay. All right. All right. So, Dr. Huang, let me ask you something. So, you've said before that when you first started out, there was no good treatments or options, right? So, we're talking about you studying about hormones and stuff. And that's why I kind of want to open up with some questions with you. And doctors only got about an hour of training on hormones in medical school. What made you decide to dig deeper and specialize in this area?
Well, Felipe, I have to say it was kind of for selfish reasons, partly because guess what? I just went to menopause this year. And also,
happy me.
And also, before when I was a younger physician and I had women come in, and they were in their 40s and 50s, and they're like, I'm having hot flashes, brain fog, decreased libido, all the typical symptoms of menopause. And back then, when I wasn't really educated in hormone replacement, there wasn't really any good answers. And I just felt like I wasn't adequately able to help my patients as much as I could. But this year has been super exciting. I don't know if you know about these two pivotal points in history of medicine. Do you know about these?
No.
So earlier this year, the American Urological Association came to the conclusion that they're going to try and remove the black box warning for estrogen cream for the vagina. So because they're noting that estrogen cream for the vagina is going to help protect the natural vaginal tissue to reduce the frequency of urinary tract infections in women. Millions of women get
I'm sorry. The only black box I know is in an airplane. So when you use the terminology
Oh.
black box, I'm kind of confused by it. What does black box mean in
Black
medical
box
terms?
means danger, danger. Like these are not good. Use with caution. Like
Okay.
it could cause cancer. Like big no no. So
Really?
yeah, so people were like, oh, but I have vaginal dryness. It's more than just painful sex. It's also, like I said, the healthy vaginal tissue to prevent urinary tract infections. So millions of women across the country get urinary tract infections. It takes time away from their family, their job. They're in pain. And what we worry about in older women with their immune system is down is they can actually get what we call urosepsis, where the urinary tract infection goes into their bloodstream and they can actually die from this. So I was watching the update on the Urological Association's meeting, and one of the urologists, she was very passionate about it because her mom was in the hospital and she was very sick to the point she was unfortunately in the intensive care unit. And she was like, this is a real thing. I'm really worried my mom is going to get a urinary tract infection. And that sounds simple to, young, healthy woman who can fight this off, just take an antibiotic. But in someone who's older and can't fight it off, it could kill them. So she actually fought to get the vaginal estrogen for her in the hospital. And everybody was like, whoa, whoa, whoa. Like, this is like craziness. Like, because it's black box, they didn't feel comfortable doing it. But she felt so strongly that would help protect her mother from dying that she got it available. But then people were like, how do we apply this? Like nobody knows anything about this. And then they were like, this is crazy. This doctor's going to apply this vaginal cream that has a black box warning that can cause cancer. But this doctor was like, I want my mother to live and not die from urosepsis. So
Okay.
pretty
So
impressive.
I'm kind of a little confused. So does this touch base with menopause too, a urine tract infection?
Yeah.
Because I didn't know that. So
Yeah.
I had no idea urine tract infections because I would have researched that and found out about urine tract infections that are
Oh, I'm
associated.
sorry. I didn't mean to throw you a little, but so
No,
because
because I was
because of
little
the
confused because I was asking you about the decision and like I wanted to talk about the FDA regulations and the oversimplifications of wanting better care for women
right.
when it comes into this, and then we went into the urine tract infections, which kind of confused me.
So
So if you, how does urine tract infections work together with menopause?
because in menopause you have less estrogen.
Okay.
And so that when your estrogen declines, then you're not having as much estrogen like nourishing the normal tissue of the vagina, then it gets dry. Do we have a question?
Oh, I don't know your box. I think I have questions on my TikTok there, but
I apologize.
you just went live on.
Oh, okay. So anyway, but you're right. So I just got super excited and I wanted to mention that. But the second thing that happened this year was the FDA in July had a 2-hour meeting. And I encourage everybody to go on YouTube and just search FDA, and that'll be the first thing that pops up. But they had this meeting talking about how women actually need hormones. And they were dispelling the myths that came from the Women's Health Initiative. And that is major. So the Women's Health Initiative, are you familiar with that?
Absolutely not.
Oh, should I talk about that a little bit?
Absolutely. I'm sure some
Oh,
people that are watching don't know what it is either.
so the Women's Health Initiative was the study that was in the late 1990s to the 2000s, and they stopped it early because what they were doing was to see if you gave women hormones, what the benefits were. But the hormones they were giving were derived from horse urine, so they were synthetic. Premarin is from horse urine, and in these women there were a
I think you
lot of
gotta accept that.
cancers and blood clots, and so what? Okay. All right. So they stopped it early because there were a huge number of people getting cancer, and they're like, oh my gosh, hormones are bad. But the problem with the Women's Health Initiative is they didn't separate what we call synthetic, like I said, from the horse urine versus bioidentical hormones. So bioidentical hormones are plant-based and they're more similar to our natural hormones, so we can assimilate it better, and it's going to work better, and there's actually protective side effects because these are the hormones that we actually need. So I love, even if you only have 10 minutes to watch the opening statement of this FDA YouTube video, the opening remarks are just astounding. So they are basically trying to now help educate people, differentiate between the synthetic hormones that were used in the Women's Health Initiative that were like, oh my gosh, made all doctors in the early 2000s say, we're going to stop prescribing hormones. And it was horrible for all these women because they're like, well, now they have no estrogen, no progesterone, and testosterone. Because do you know that women need testosterone too?
Absolutely.
So the main speaker who started the orientation of this YouTube said his mother actually fell and broke her hip, and he wished that she had been on estrogen treatment. But back then it was like big voodoo. No, we're not going to do it. So now the FDA is finally coming around and differentiating and saying that women actually need hormones. So it's really exciting.
Okay. All right. All right. So I got a few questions anyway. So menopause symptoms beyond the basics I want to talk about. So most people know about hot flashes, right? Brain fogs, maybe low libido, but the list of symptoms is so much longer.
Hmm.
So you have insomnia, you have anxiety, hair thinning, palpitations, phantom smells, even frozen shoulders and plantar fasciitis, right? Why do so many of these get overlooked?
That's just such a great question. That just makes me think. I had a patient who came in earlier this week, and she was pretty young. She was in her 40s, and she had gone to the dermatologist. She was having patches of eczema, and she came in and she talked to me, and she explained about the eczema. And then she was also like, "I feel like I'm having ringing in my ears." And she goes, "I literally feel like I'm going crazy, and people think I'm crazy." And so I go, "Well, let's talk about it. Let's talk about your I always say, how are your menstrual cycles? Are they regular? Even if there's a slight change, they're getting shorter or not lasting as long." And I said to her, let's run a hormone panel. I was like, you could be in perimenopause. And she like literally started crying. She was like, oh my God, I was so nervous about this appointment today. I thought you were going to think I was crazy. And I was like, no, you're not crazy. I go, your hormones are crazy. And I think that there's just a lack of awareness that these hormones impact like so many body systems. And there's just so much more that we can go into this about how it affects your skin texture and like gives your skin better texture, like affects your hearing and things like that. And the main point that I want to get across, because it's also menopause awareness month, is if you're perimenopausal or you're in menopause, you're not crazy. Your hormones just need to be adjusted.
But my question is, how's it being overlooked? How are you, like you said, you went in and you started like going, okay, maybe let me do a hormonal test. So how is it being overlooked? Obviously, you catch the balance, but so many medical people, doctors like you and everything, how is it being overlooked? If we're having this much situations, how's it being overlooked?
I think it
How's
goes
it being dismissed?
Yeah, I think it goes back to the lack of education. So as you mentioned, yes, in medical school, we only get maybe an hour of education on menopause, which is hardly anything. And then number two, I think the biggest thing that I get is people say, well, they checked my labs and everything was normal. And the thyroid, especially, because I always say, did they check your thyroid levels? And they go, oh, yeah, it was normal. And then I was like, well, let me take a look at them and let's do a deeper dive. And then when I interpret it, I may interpret it differently than other providers. And so, I mean, that's a whole nother discussion about thyroid. So I think that people are interpreting labs as normal when they're actually not normal, and there's not enough education for providers.
So basically, lack of education in some medical
Absolutely.
doctors that need to be versed more into that field.
Absolutely, because going back to Women's Health Initiative in 2002, when they stopped the studies prematurely, because the study was supposed to go to 2005, I think all gynecologists and primary care doctors are all like, "Ooh, we're not going to touch this. It's all bad, and it's been in the back burner, and we've been very, very conservative, trying like supplements, like black cohosh for like hot flashes, or we'll do like really, really low doses, but don't really do anything. But we're so afraid that the Women's Health Initiative said that these things cause cancer. But now the FDA is calling the study out and saying there is actually no direct correlation between estrogen and cancer. There was no proof that one causes the other.
Okay. So one of my things that I wanted to say, I always tell people, especially when I had my vitamin store and everything, and people would come in, and I would state to them, you know your body best. So in my head, I'm thinking to myself, if I'm walking in and I have these symptoms and I have these things that are discouraging my body, right? Why aren't doctors like saying to them, you like tell your patients you know your body best, right? Why is that message that I feel on my side so important that could help a woman go through menopause when you say to them, you know your body best? Like if you're knowing these symptoms, like why aren't people just inquiring this, like saying, what symptoms do you have and what situations are occurring to help that doctor kind of analyze the situation more? Because I'm going to be honest with you, I didn't know plantar fasciitis was one of the symptoms that possibly could cause menopause. I had no idea about that until I started researching it. Like, why do you feel that? Like, what empowers women to explain self advocacy, right? When doctors dismiss them. Like, if I'm a female and I'm telling you I'm having this problem, why are doctors just dismissing it and saying, "Oh, okay." Oh, I'm sorry. Can you click that?
When we
But
click
it
it
means
for
you got
you,
more
for
followers.
you
Yeah, please.
over here,
Yeah, all right.
continue.
Yeah,
Oh,
got them in.
okay.
Hello, 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 everybody. Oh, you know what? End that. Sorry, everybody. Oh my God. Sorry, everybody. I just asked Dr. Wong to click on something and we just invited about 40 people onto a live show.
I don't know.
I'm sorry. 2 seconds, everybody.
All these people want to learn about menopause.
Your wife is so cute.
Thank you. Thank you. I
He
appreciate
just
that.
said that his wife was so cute.
Thank you, everybody. You know what? You guys can stay live because you said my wife is so cute.
Okay. Shoot. Is that good?
Yeah, there we go. There we go. So
Okay.
go ahead. Go ahead,
So-
Dr. Wong.
I think that's a great question. And I think part of this lies on women. I think that we have to be a little bit more outspoken. So, as women, we tend to kind of maybe minimalize symptoms, and some of the symptoms aren't like life threatening. So, we're kind of like, oh, I can live with a little frozen shoulder, or I can live with some dry patches of skin. So, we don't necessarily speak up about these things because they're not like crucial. So, and they're not like giving us like chest pain, and so we just are kind of like minimize it. So I think that if women start doing their part and coming into their doctors and being like more outspoken, saying, listen, I have these symptoms, and not like maybe just brushing them aside and taking them more seriously, and then the doctor needs to on their part take it seriously and do a deeper dive.
Okay. I like that. I like that. Because I do, after speaking to you for quite a while about this situation and how this interaction is occurring between patient to doctor, I'm finding it so interesting that how much it's being dismissed and what the situation, which leads to this, which now we're going to discuss the role play after this has been a decision. Look, even more people want to join. That after it's been adjourned, a lot of people in India. Weird. But I'm sorry, everybody. We're getting into lab testing now. I wanted to discuss the lab testing and the insurance. So, like with all this stuff that's occurring, what should women insist on testing, and how does insurance play into it? Because I know at times you start to discuss about, obviously we're having these symptoms, we're having these things that are occurring. Now we move into the next step. I want to talk about labs. I want to talk about what should women right now that are watching, what should they, say, hey, listen, because you're not doing this, I need to be tested for this.
Sure. So that's a really great question. And I would say, as a primary care doctor who takes insurance, this is very frustrating because there's a lot of women and men that I want to help And my hands are tied basically because of insurance, because they come in for their routine physical. Insurance usually covers for a routine physical, their cholesterol, blood sugar, blood count, to make sure you're not anemic, and then your basic liver, kidney function, your electrolytes, which is all well and good. But that is not going to be any indication of where you are at in terms of all these hormones that your body needs to make you feel and operate on a great level every day. So I have this discussion with my patients who come with symptoms, and I say, I would love to get a full panel, and we'll get into that full panel of blood tests. But unfortunately, if your insurance doesn't cover, it's going to cost hundreds of dollars. But these are critical to help you figure out what is the cause of your imbalance. So I have contracted with a lab outside of my hospital that I send people to, where we can get it for a discount price of like $170 for a female panel, like $120 for men, which I hope that most people will do. And thankfully, the people who are invested in their health are like, yeah, you know what? That's worth my health. I'm going to do it, which is fantastic.
Okay. So one of the questions that I wanted to discuss once again is, what should they insist on testing? So I remember me and you were going back and forth. You had, and I'm going to list them, and can you just go through them and explain them? And if I did forget something on the list, please add it to it. So I know you were talking about free T3, SHBG, progesterone, vitamin D, B12, thyroid. Explain the medical necessities in the rules to all this. Okay. And if you want me to repeat it, please ask me to. If you want to start out, let's discuss the free T3.
Okay. So so
I'm sorry, everybody. My apologize, Dr. Wang. We keep having people requesting to follow. So
okay. Well, this will give me a chance to do my little drawing. Okay. All right. So this is an example of one of the tests that I say that when people say they got their thyroid checked and they say it was normal, and it actually wasn't normal, this is a very, very crucial test, the thyroid hormone levels. And when I went for my hormone training a couple years ago through Vexius, there was a great lecture on thyroids, and
I'm sorry, who's Avexius?
That is the company. I'm wearing their T-shirt. It's not helping
I've
me.
noticed, but I'm trying to
They
help you get the name out there
They
again.
produce hormone pellets, estradiol and progesterone, and supplements and nutraceuticals to help the balance of the hormones. So I went to their training a couple years ago, and I was like, okay, I need to learn about how to treat hormone symptoms. So I went to there was this fantastic lecture on thyroid, and let me tell you, it changed everything that I learned in medical school. And I've had this conversation with other medical providers, and they were just like, this rocked my world. It completely changed everything that I thought about the thyroid. So we all know about TSH, right? Have you heard about TSH?
I know, but maybe some people watching. So is this we discussing the free
We're talking
T3?
about the free T3.
Okay.
So I'm going to draw a little diagram here. Hopefully people will be able to see it. So this is your pituitary, which is in your brain. I know it kind of looks like something else, but it's your pituitary.
Looks like a W.
Okay, looks like a W.
Mm-hmm.
And then this is your thyroid, which is a gland here. And I call it your control center for your body, kind of like your thermostat.
Yeah, so that's
okay, like your body's thermostat. So basically, your pituitary, which is in your brain, releases TSH, which is thyroid stimulating hormone, to tell your thyroid to then release these hormones. So we release a lot of T4 and a little bit of T3. So lots of T4 and a little T3. But guess what? T3 is the main chemical or hormone that goes into your body that helps with like brain fog, energy, like your skin, constipation. It's the main hormone for everything. But your thyroid makes a lot of T4, and then we hope that your body converts T4 to T3 because of this enzyme called D1. Okay. All right. Any questions so far? And then your T4 is what tells your pituitary how much TSH to release. But why does that even matter? Because what we really need to focus on is T3, right? So the issue is when people come in and they say, oh, my doctor checked my TSH and it was normal. And then I say, but did they check your free T3? And they're like, No, but they checked my free T4. And I'm like, but how do we know how much T3 you would have? Because that's actually what we need. So very, very important. And so I have a lot of women who are on thyroid supplements because every woman who goes into menopause is like, oh, I have problems losing weight. My hair is thinning. I'm tired all the time. And they're on thyroid supplements.
Sorry, everybody. I know you got to erase that to do the next thing. And I didn't get you a napkin.
Oh,
Go ahead.
so nice. So a lot of them are like, well, I'm already on thyroid medicine. I'm on levothyroxine or Synthroid. It's the same thing. But guess what? That's only 4. Oh my gosh. And if your body is taking all this T4, but it can't cover in T3, what's the point? So I have a lot of women who are like, I've been taking this for years. I don't feel any better. I feel the same, or I don't. And so I'm like, we need to get you some T3. And so that's natural, or what we call NP thyroid or armor thyroid. And that has T4 and T3. And then guess what, Felipe? Do you know why in women in menopause this T3 goes down? Because you need enough estrogen to help you convert T4 to T3. So you're not crazy. It's not something, it's all very interrelated, and the balance is crucial.
So the reason why you should get T3 tested for is?
To
I'm just asking. I get all this chemical
I got
ratio,
really excited.
molecule structural T4, T3.
Oh, because
But
T3,
what's the reason to it all?
free T3 is one of the main hormones that controls your body's metabolism.
So T3, everyone, is your
Metabolic center control.
And what does that touch base on?
Energy, concentration, hair, your GI. So if it's underactive, you're going to be
GI is my
So if it's so if your T3 is low, you're going to have weight gain or difficulty losing weight.
That's what
Hair thinning.
Hair thinning.
Constipation.
Yes.
Dry skin.
Yes.
Okay. And then
one more thing.
Uh,
I was just saying it. I didn't know if there was one more thing.
Basically, you're going to feel like crap.
Okay. And that's why, because when I'm asking you, I understand, like, obviously chemical compounds, the breakdowns of it, molecular structure of all of it. I understand. Want to discuss that. But I think for certain people, they want to know what it affects.
Oh, it affects your whole body.
It affects, but you just broke it down, because now, if that's all it affects, then what does SHBG stand for? And what does that affect if you don't get it checked for?
Oh, the BG is sex hormone binding globulin.
Yep.
So that
so how do you say the G?
Globulin.
See, I say globian. All right. No, I'm just saying.
Sex hormone binding globulin.
Okay.
So that binds onto your active hormones that you need, estrogen and testosterone. So the higher it is, that means the less of your active hormones are floating around.
So you're saying if this level is at a high rate, and then how is it going to affect me sexually?
You're going to have less of your hormones that you actually need in your body to perform everything.
And what's everything? The same thing, hair and everything? Is it all?
Yeah, it's all very, we have to break it down. But like I said, like we need estrogen to convert the T4 to T3, and then you need.
No, I understand that point of it, but you got to get into all this again, everyone. Everyone's going to be like, okay, I see the compound, but what does it physically affect on me is the question.
Because your body already has its own hormones, estrogen, testosterone, but it's bound up and it's not able to utilize it that needs. So you need testosterone and estrogen for like libido, right? You need testosterone for like muscle tone.
So SHBG is testosterone.
Well, it's binding to your hormones.
It's a binder to the hormone to make everything work together.
No. It's taking your hormones that are floating around, keeping them from doing their job.
Keeping them from doing the job?
Yeah.
Why would you want to keep something from doing the job?
Exactly. So if it's too high, it's no good.
Oh, okay.
So that's just another piece of the puzzle.
Okay. So now let me ask you something. I see that we're also discussing progesterone. Mm-hmm. How does progesterone, when a female walk in, like, how do I know what progesterone is if I was a female? And how would I know how it's affecting? Like, why would I go in and say, check my progesterone? What is that about?
So actually, progesterone is one of the first hormones that starts to decrease. So progesterone is very important in like pregnancy. And then once women start moving out of their reproductive age, like in their mid to late 40s, the progesterone goes down. Progesterone is a calming drug. So
Oh, you need to take a lot.
so
Okay,
when your
all right.
progesterone
I'm
drops,
checking that off. We're bringing that up on you.
I take it every
We're
night.
going to bring that up. Doses are going up.
So
I'm mocking that.
progesterone is calming. So when women make less progesterone, we start to feel anxiety, heart palpitation, racing thoughts.
Really?
Yes.
Heart palpitations.
Yes.
I did read about that.
Yes.
And that's concerning because does heart palpitations go into anxiety?
Absolutely. So a lot of women in their 40s start getting to prescribe what we call SSRIs for anxiety or depression, like Prozac, Lexapro, Zola, but they might not need these if we just balance their hormones. And you know what's also really sad in the Women's Health Initiative? I'm just going to go back. There were many, many divorces after women stopped getting their hormones prescribed because, I mean, just the lack of progesterone. We haven't even talked about estrogen and testosterone yet, but progesterone is a calming drug. So
Which we'll move on to. Once again, we'll move on. Okay, so that's pretty interesting about the progesterone. So you kind of wanted to talk about vitamin D and B12.
oh wait, can I just we'll talk about later.
So you wanted to talk about vitamin D and B12. What's the concerns of that being checked out? And I understand because we're from the Boston, Massachusetts area with the vitamin D and we don't get enough sun and all that. But how does this play into the role of menopause with the vitamin D and B12?
So vitamin D3 is really, really important not only for your immune system, but it's also important because it helps with the metabolism of estrogen. So it's really important. So let's go back to the lab levels. So everybody in New England, as you were saying, is pretty low. Like their lab level is usually around 30. Wait, do you know what the um, optimal level of vitamin D is?
No, I do not.
It's around 50 to 70.
Really?
Yeah. So
Okay.
everybody in New England, because the people that I test, they're all around 30. Everybody in New England
Now,
is
and
at
I'm
that.
sorry for interjected, but does that change from summer, fall, spring, winter, or does it just stay at the level of 30?
It's at the level of 30 all the time. So when I tell my patients who are deficient in vitamin D, I say you need to take your vitamin D supplementation every day, all year round, because even when we're in the sun, we're supposed to be wearing sunscreen. So that minimizes it. And if you have darker complexion, that decreases your absorption of vitamin D. So we are all very deficient. And vitamin D is also important for your mood too, your happiness. So I think if a lot of New Englanders started taking some vitamin D, we'd all be a little happier and less
Okay.
sick
All right.
because it's important for your immune system.
So how about B12?
B12 is a vitamin or supplement that is super important for your entire nervous system. From your brain, it helps with concentration and memory to the actual use of your arms and legs. If you are low in B12, you'll have what we call neuropathy, which is the numbness sensation. And in severe cases,
Where does neuropathy actually go? Is it your hands, feet, or your whole body?
it could be your whole body,
Really?
basically your limbs, though,
Your
and
limbs? Yeah. 'cause
and
that's what
then
I
in
thought.
severe cases, you can have lack of use, like you could end up in a wheelchair.
Aye.
So B12. So this is what I find frustrating about the B12 lab. So when you get a lab panel back, the normal range is from 200 to 800. So someone gets their result. They're like, yeah, my doctor checked my B12 and my level was 300. They think they're great. But guess what? Optimal level of B12 is 7 to 800.
So when you say the word optimal, you're meaning that's the level. Like you don't want to be below that level. You want to be right in that prime spot right there.
To feel your best and to function your best.
Okay. All right. That's pretty interesting because I didn't know that. I didn't actually know it was that high of a level. So you kind of also wanted to talk about the thyroid, which I found pretty interesting just due to the fact that I have a lot of family members and stuff that take medications for this thyroid. And I understand the thyroid and I understand how it functions and how it does it, but why is it vital when it comes to menopause for them to look into it?
Well, as I said before, when your body makes less estrogen, then you're not able to convert T4 to T3, which is the active form. Oh, and I learned something else interesting recently: ferritin levels. ferritin, which is kind of like a marker of your iron level, you have to have adequate ferritin levels to also convert T4 to T3. So this is not part of a normal routine physical lab panel. Um, the thyroid is critical for all of us because, like I said, it's like your control center for your metabolism.
Okay. So, and with estrogen decline, right? Because that's what you were discussing earlier. So I'm kind of going back a second. Even thyroid conversion gets affected, right? That's what you stated, and that's where your free T3 drops.
Yes.
Okay.
Yes.
So when your estrogen declines and even your thyroid conversion gets affected, that's where your free T3 drops because T4 isn't converting anymore.
Correct.
So when you put it all together, when you get this test, right? These are what you would tell people they should ask their medical doctors for testing.
Absolutely.
Cross your panels to test for all three of these.
Yes.
Okay. So we basically are saying definitely get your thyroid checked, definitely get your T3 checked, definitely get your T4 checked, get your vitamin D3, get your
vitamin D25.
Vitamin D25.
That's
Okay.
the active form of vitamin. There are
And
many
vitamin
different.
B12 in your thyroid. So basically, if you're feeling that you feel because you know your body best, you should tell your doctor, go up and say, hey, listen, I want to be tested for this. It's not your doctor's decision. Listen, I need to be tested for this because this is how it's going to check. So that's what you're trying to say?
Yeah. And then one thing we've tried to do to help our patients be more vocal is we have what we call like a symptom sheet.
Yeah.
So we give that to patients because they might not always like be like, oh yeah, I have this, but it kind of like prompts them. So it's like a whole list of like symptoms that can happen as your hormones go down, like for men, even like, your beard growth, is it like not growing as full, or like, and women like decreased libido.
I think yours looks great.
Thank you. Well, I have testosterone, but it hasn't affected my hair growth.
You don't have a beard. I was being sarcastic. Go ahead.
But like to help prompt these and open up the conversation, I think that providers have to be more open to it and understand that these are like really important things that not only affect your patient, but their relationship with their partners too. Right?
Okay. Great. So I kind of wanted to dive in now, since we've gotten that all out of the way on that concerning part of it all. I want to talk about treatment options. Okay. I wanted to talk about the good, the bad, and the risky.
The ugly.
Yeah. Well, I didn't put ugly. I didn't want to use the word ugly, but okay, we're adding ugly. Okay. Let's break it down. Let's get the whole treatment landscape: synthetic hormones, pills, Troches, okay? Listen, I say troches. It's spelled Troches, okay? Isn't that like French? Troches. No? Okay, I'm trying. Patches, pellets. What should
Creams,
women
gels.
know about the risk inconsistency? Okay, so first, I want to talk about the landscape of it all, synthetic hormones. So I want to talk about, like I said, the pills, the troches, the patches, the pellets. What should women know about the risk and the inconsistency? So, can you explain the pills? Because I saw that when you were speaking about it, the reason why we were discussing the pills was because you felt it was a liver risk, correct? And can you get a little in depth about that, please?
I'm going to be honest. I can't speak too much on them because I personally don't recommend them. But I can tell you, and the reason why is I don't think they really work. And because yes, there's a lot of what we call first pass metabolism where they're all broken down the liver, and it's a lot for your liver to
And
handle.
how many times do they pass through your liver?
I don't know.
6 times.
6 times.
6 times it keeps going through your internal system to break down the component without even have a binder or anything to extract it in. So it's pretty interesting.
So I know for a fact. So I've never recommended oral hormones. So I had a gentleman who came in, and his wife was actually seeing me for hormone replacement therapy with pellets. But she was like, I really want you to see my husband. He's been spending literally thousands of dollars at a men's health clinic and getting oral testosterone. And he'd been getting it for like 8 months. I was like, wow, that's really interesting. I've never heard of oral testosterone. And I was like, I don't even understand how that works. So I had him, he came in to see me. I go, how do you feel about it? He goes, I don't notice a difference at all. And I'm like, really? So I said, let's draw your testosterone level. Let's take a look. Guess what his testosterone level came back at?
I'm going to say, if you're asking me to guess, I'm going to say most likely the levels are 300 to 400.
It was 200. It
Jesus,
was
that's nothing.
200. And so for viewers, the optimal range for a male testosterone level, I would say 800, 1,000 probably is like the sweet spot.
Yeah.
So I was like, wow, you're basically they did nothing. So and we confirmed it in a trial of one real antidote. So I was like, well, this is interesting. I go, so not only have you spent thousands of dollars on something that's not working, but could potentially be affecting your liver. So I really don't have much to say except for I don't think they work and they're really bad for your liver.
One thing that I just want to intercede on is it's pretty interesting that you say that about the oral testosterone, but also what I feel is the failure of educating people on how to take supplementations. So some of these supplementations you need to take with fat soluble products.
Mm.
Okay. So when you're doing a free testosterone or a TRT and you're doing a pill, you actually got to have something for it to bind. So if this guy's getting up in the morning and he's just taking a pill and he's doing it in a fasting state, it's not going to work. You know, certain products, methylated products and everything, you need a binder in order for your body to absorb it. So now he's going into that processing phase, as you had stated it. So now it's going through the body and going through the body, but it's actually going through the body and out the body. So I think when people get into pills and understanding how the demographics are, they need to understand certain things you need to take with food. And I think, you know, obviously I feel you're very educated in this field, but I've known from other doctors that I've spoken to or even products that I've taken, they didn't even know that. So when I'm telling them, you know, it only works if you're taking it with food. What do you mean? And then all of a sudden they look it up and they go, oh my God, you're right. And I'm like, so you can't just tell your patients, take this, take that, because most patients are just,
Yeah, we'll get to that.
you know,
So that's well, so the exact opposite is true. The thyroid. The
yeah.
thyroid you have to take on an empty stomach and wait 30 minutes before you take anything else, because that can affect how it's absorbed. But so I have a question. Do you think that this gentleman, if he had been maybe he wasn't taking it with food, maybe if he took it with a fat soluble diet, it would have increased his efficacy from the testosterone? Who knows?
I'm going to say absolutely. I'm going to say that it's interesting because we're a product of our own design. And what I mean by that is when we see someone that looks so great, we want to take what they want to take. But they got to understand they've developed their little system, so they know what they're doing. If they're doing anabolic steroids or anything else and they're up on that stage and they're competing, they're doing the caloric intake, they're doing their vitamins properly, they're basically doing their cardio, they're doing their whole thing is programmed in. But most people think if I take this and I take that because this guy's taking it, I'm just going to take it. It's not going to work the same. So I think through misinformative education is doctors need to explain to patients, even if it's a simple vitamin A, vitamin D, do I take that with food or I take it on an empty stomach? It's funny that if you give me prednisone or if you give me some different, you automatically say, make sure you take food. But something as simple as vitamins and supplements, you just say, yeah, just add this to your product. For instance, my mom, very bad bones, right? She was taking vitamin D, empty stomach. It's not going to work.
Soluble vitamin A, D, E, and K.
Thank you. She needed to take it in with a good fat. I would tell her avocados. I would tell her to take
bacon. Oh, she
yeah,
didn't
no
bacon.
bacon. But people got to understand that. So it's like the miseducation and not letting them know. It's not as simple as just take this, right? It's take this, but take it with this. You know, it's like, can I take it with a burger? Can I take it with take it, but take it correctly. And I think that's where the miscommunication is with the medical and like people like me.
Well, we don't get taught any of that in medical school.
Well, and I know that, and that's shameful because you're the person I entrust in my life. You know, I'm seeing you because you're the person that's supposed to make me feel better. You know what I mean? So
wait, before we skip, I was going to talk about the oral. So I don't think anyone would propose oral estrogen. So back in the day when I was like didn't know that much about hormones, when women come in with perimenopausal symptoms like the hot flashes, things like that, we used to like ease people into menopause by giving them birth control pills. But that would still be
I
like,
didn't
because
know
it's a
that.
small dose, we would still kind of like hold our breath and be like, okay, make sure you don't smoke, make sure you get up and walk around because risk of blood clots. And so the amount that you would need, in these older women, we kind of would be like, is this safe? So I don't think anyone would recommend oral estrogen. I certainly wouldn't. I just think that the risk, because they're all synthetic.
I just think that's kind of funny that you just said that. So to me, you basically just self-admitted that you're given something to hope to ease this situation, but also on the other side to hope it doesn't cause another situation as of clotting and stuff. And I find that interesting because we both know I have blood clots out of nowhere, and it's not genetics, it's not anything. It just happens. And I've been on Xareltos. And so I find that pretty funny. Let me try this. And if it works, ace in the hole. If it doesn't, sorry.
Yeah.
That's scary.
It
That's
is.
very scary. Okay, well, thank you. I didn't realize that, and I didn't know it was birth controls. So this word here that I like to say, trochets, can you explain what is and the inconsistency of it?
A crochet or troche. Oh gosh, you have me saying it
Damn
now.
right. Damn right. My show, my house. Trochets in the house.
Is a dissolvable lozenge. So I also am not too crazy about these because I feel like the levels can be inconsistent in your bloodstream and they metabolize pretty quickly. These might be good for someone who is thinking about going into hormone replacement therapy but doesn't want to like commit to something like pellets. So we could like ease them into it, because with pellets, which we'll talk about, that's more of a commitment because it goes under your skin and stays there for months and is slowly released. So someone who wants to try hormone replacement, I could say we could try this, but understand that your symptoms may not be completely solved because the metabolism isn't like it is so quick that the blood levels aren't that going to be that great.
So if you were to do the crochets, you're saying it's a lozenge.
Yeah.
So
You,
when you're taking the lozenge, what, you're just sucking on it like a candy drop?
yeah.
So, that's pretty interesting. I
Yeah.
didn't know
Again,
that.
I'm not a
Okay.
big proponent of it.
Okay. So I know we're gonna get into the pellets, but one of my questions is patches and creams. Now, to me, I find it pretty interesting that, everyone's like, oh, I'm on thyroid creams and this and
Do they
that.
say it
And
with
I'm
that
all,
voice?
yeah,
They
they
go,
do.
"I'm
Yeah,
on."
I'm with the thyroid cream group, and we like to do thyroid
They have
creams.
thyroid creams?
I
Oh,
don't
yes,
know.
they do. Yes, they
Yes,
do.
they
Yes,
do.
I
They
have
do.
some patients.
Yes,
Yes.
they do. But patches and creams, okay? What's up with that? And what's up with the transfer issues? Because I know for a fact, I basically, no matter how much I research on it, I see it's a very, very waste of time, waste of money, to be honest.
I'm going to agree with you. So I know this is a menopause talk, but we're going to talk about the men too, because women were also using testosterone gels and creams off label, a much smaller dose. Again, this was back in my days before I knew as much about hormones. We used to do like one little pea-sized dab, like behind the knee or on the wrist, whereas the men would use a whole 5-gram tube. But what you do absolutely have to worry about transfers. So what you're talking about is the gels and creams you have to put on every day. You put it to your shoulders. And then if you go and hug like a baby or a woman, like you have to worry about transferring it to them. So there's that risk. And then also with the topical, the metabolism is very iffy depending on the amount of fat, subcutaneous fat, right? So it's going to be very different from person to person. If you're a lean person with less fat, you're going to get a different amount of it being absorbed versus if you have more subcutaneous fat. So it's
So if I was a mesomorph, because you keep pointing at me, so you're saying that
no, I pointed to you
testosterone
for
cream-
both of them.
So you're calling me a
I said
meso?
if you're a lean man, and then I also pointed, I said, or if you had more subcutaneous fat.
So there's obviously major issues with the transfer issues, like you said, rubbing off, putting your clothes on. Some of it you could be losing 10 to 20% of it, is what I read, onto your clothes. And then when you sweat, it breaks down the process of it absorption. into the skin. Also, what I read about was if you have hair, you're gonna have to shave because you need to get that cream into the body because now the follicles will now receive part of the transfer. So there's so much more to the inconsistency of creams, and I just love it because like you just said, is some things you have an optimal level to get. So all of a sudden I'm on this cream for over 9 months and I'm like, I'm 20%. Oh, I got 20% now on my level. It's 20%. You've been on it for 8 months. We could have put you on, which we're going to go on to, which is the pellets.
No, before we go there, let's go back to the women. So we talked about testosterone in men.
Yeah.
So for women,
I thought we were talking about both. Okay.
Yeah, but for women, there's the estradiol patch. It's a little patch that you can put on. Again, absorption depends on subcutaneous fat. I had one woman who came and was like, I don't think this is working. And I'm like, even though I don't prescribe them, I do know this. I'm like, are you rotating the site? You have to keep rotating the site. You can't put it on the same site apparently for it to.
I did not know that. Why?
I don't know. We should look that up.
I did not know that.
I think
I have to bring that up next time.
For the efficacy.
If anyone that's watching on YouTube, Cece, find out why. Put it on. Why do you have to rotate patches for the estradiol?
I'm not gonna lie. I think the women who use it's a pain because it gets like the little you have to take it off with the alcohol pad. It's sticky. But anyway, and then the creams that they use, the vaginal creams, and no one likes to use them, so they never get used appropriately. So it's supposed to be 3 times a day. So Cece says it gets disgustingly dirty. Okay, yes, that's
okay. So the answer is it just gets disgustingly dirty.
She's gonna look up the rotation part, but yes, people have said it gets.
Say she's gonna look it up.
Yeah, she's gonna look it up. But
All right. Thank you, Cece.
It gets dirty because the black. You get this black stuff around it, whatever.
Black stuff.
When it gets dirty, okay, forget it. So anyway, the vaginal creams to help with vaginal dryness and prevention of UTIs. It's every day when you first start, if you're super dry, then 3 times a week. No woman likes to do it because it's messy. And then you're like, oh, I'm going to do it at night and then hope that we're not going to, have intercourse and blah, blah, blah. And so nobody uses it and they're messy. And so then they end up not working because of that. But also, it's not addressing the major issue of that's just local estrogen. It's not going to replace the estrogen in your whole body that you need for bone strength, cardiovascular protection, cholesterol decrease. We didn't even talk about all the benefits from hormone replacement.
That's decreasing Alzheimer's. We haven't got into it yet.
Oh,
we're working our way there.
Oh. So anyway, okay, that's my spiel about topicals. Okay,
so let's move on to the pellets because you were talking about it's a steadier option. So at the end of all this, and you've obviously, I know you own Caring for All, located in Winchester, and now you've brought in all the TRT.
Do you want to explain what TRT is?
It's your house, your show. You explain
the TRT. When he says
TRT,
he actually means HRT, which is hormone replacement therapy. TRT is testosterone replacement therapy.
To me, it's the same thing. What's the difference between HRT and TRT?
Well, HRT is more inclusive, of estrogen, progesterone, and testosterone. When you say TRT,
so if I'm a guy and I go in there and you're doing HRT, what are you actually doing?
TRT.
Thank you.
Okay.
So it's all the same to me. So Cece, what does it say?
You have to rotate it because of skin irritation, redness, itching. The skin becomes resistant.
Oh, I didn't know. So resistant means what? Dead?
It's not going to work anymore.
Okay. So
thank you.
Let's get into the pellets right now, because I know your practice and you're very versed in this. And, I've had the honor of going to you with these events and we've sat there and it's been an incredible venture with that. And I see that you're growing. One of my major concerns is it seems like, and this is what I wanted to discuss was, so you're doing the pellets, you're doing this and that. You're actually coming in when people are doing it. You said you make them fill out a sheet, and a sheet's going to have all of these symptoms that they're lacking, right? And they check off the box. Then right after, you do a lab test on them, and you're testing them to see their overall blood work panels, right? Then that's going to have you gauge which I'm going to have you discuss, what pellets and how many milligrams and all this, and how it's basically a steadier options out of all these to do, right? But what I've also noticed is this. which I love on how educated you are, and I appreciate that you took this serious. And unlike other places where I have friends and even myself, when I wanted to jump on TRT at the time, and they told me just swipe my mouth and send them in, and they just give you a
They do a
bottle.
saliva test.
Yeah, they do the saliva test, and obviously, and they just give you the bottle. Like they don't regulate it. They don't just every time swipe your mouth. This is what you do. Don't worry about it if you're tired. You need this and that. Now you get more involved. You want blood tests, and you want this. So I want you to discuss, the pellets, and I want you to explain to me why it's a steadier option and why is it so involved that you do it blood wise and you're not asking like other clinics when people are just walking in and next thing you know they're just doing testosterone and their estrogen is imbalanced, their estradiol is off, and their progesterone. Then they come and see you and you're like, well, did they test you for this? Did they test you for that? Then you're finding out no. So now you have to go in and fix these issues and situations by doing it the correct way.
Mhm.
So I kind of wanted to talk about that because there's so many clinics that are opening that every guy or every girl's like, oh, screw it. I can just go there and get it from them and I don't have to go through all of it. But they're not getting it, especially menopause and all this. It's really screwing up your body because you're not doing it correctly. So can you get into the pellets?
So the pellets are bioidentical, so they're plant-based, and as I said, it's exactly how it sounds, bioidentical. So they're more similar to our own chemicals in our body versus something like from horse urine. So it's natural, and they're not going to have the side effects. In fact, they are completely safe in people who have women who have had breast cancer, or people who have had blood clots because they're actually anti-inflammatory and protective. They can actually decrease your risk of cardiovascular disease by replacing your body's own estrogen and testosterone. So first of all, they are completely safe. Remember, these are different from the synthetic hormones that are in the Women's Health Initiative. So the pellets, they're about the size of like a grain of rice, and pellets are come in estradiol for estrogen supplementation or testosterone. So, like you said, we do a full blood panel and then I look at your levels and we can customize. So, for example, the estradiol pellets come in different doses 6, 10, 12 and a half. So, we can really customize to exactly what dose you need. And the testosterone, I mean, the smallest dose is 12.5, but we would never do that. But each is very customizable. I could do 87.5 to 100 and really tailor it to exactly what you need. And the procedure to insert the pellet takes less than 5 minutes. You come in, I numb you. In women, it goes in your upper butt, and in men, it goes in your love handle. And I just use an instrument to slide the pellets in under your skin. And I put a small butterfly steri strip over and a waterproof patch so you can shower later that day. No excessive activity for the rest of the day, but then the next day you're fine. And it releases slowly. For men, it lasts about 6 months. So I kind of describe it as like licking a lollipop, like, like layers of a lollipop. They're kind of slowly being like released into your bloodstream. So it's a more what we call steady state. So you don't get these highs and lows that sometimes men can get when they inject testosterone from an injection. They have to do that weekly. And that's because the steady state is so quick. So they do it like on a Monday, maybe by Thursday, it's starting to go down. Men sometimes can't last the whole 7 days. And then by day 5, they're like, I need more testosterone. Versus with the pellets, it's just very steady and then it slowly starts to decline. But then you come in for your next round of pellets. For women, it lasts about 4 months. Yeah.
Okay. So we're discussing these pellets, but what is this in concerns with menopause? Like, why would you tell people that they should look into getting pellets and getting the HRT treatment, like, and to get these tests to do these vitamins together? How do you package that all together?
Well, menopause is by definition your body's producing less of your hormones that you need, specifically estrogen, progesterone, testosterone. So we can replace what you're losing, that your body needs. Because, like, let's say the average woman in America menopause is 51. but that your people are living until their 90s, almost to 100. So what are you going to do? Suffer for the next 50 years without these necessary hormone levels? So again, it's not just about quality of life in terms of like decrease hot flashes, vaginal dryness, libido, but it's also improving your heart health because, like I said, it decreases your risk of cardiovascular disease. In the FDA YouTube video, that if you watch it, the introductory speaker says that if you start estrogen therapy within 10 years of menopause, you can reduce your cardiovascular risk by 50%, the same as going on Lipitor.
Really?
Yeah, and it decreases the risk of dementia. So you're living longer, but you're not going to lose your marbles.
And Lipitor is bad, right?
Well, it can affect your liver, it can give you muscle aches. So, but if we can get to the root cause of treating the issues by replacing the hormones, and like I said before, like women, they start losing progesterone and then they get anxiety and they feel palpitations and they have to go on SSRIs, which kills your libido. That's a major side effect. So instead of putting a band-aid on things, we're actually going to treat the root cause and help you get back to how you were before your hormones started to fail you.
Excellent, excellent. So one of my questions, and I know you're probably not prepared for this, and if obviously don't know the answer, but we've spoken a lot about this in the pellets and brought this in and all these positive things. Is there any negative things from doing pellets in HRT and TRT?
Um,
So that people should be concerned on when they come in, because there's a lot of positive, but we
Sure.
know out of positive, there's also a lot of negatives,
sure.
or some negatives, should
Yeah.
we say.
Yeah, sure. So I would say for men, it's pretty simple. Testosterone replacement's pretty simple. It's one hormone. Men do great. They love it. They come in great, great. I mean, I hear things like, oh, like my golf game is better. I can drive further. They have more endurance at the gym. They can lift more. Men is pretty straightforward. With women, it gets a little trickier if they need estradiol. So estrogen, what it does, so not every woman needs estrogen. So actually, I'll share my story. So when I first started hormone replacement therapy with pellets, I only needed testosterone because I wasn't yet in menopause. I was perimenopausal. And then so I'll and actually since we're discussing this, so I kind of knew that I was going into menopause. My sensation was I had this weird burning sensation on my skin. Like I felt like if people barely touched me, it would hurt, or it just, and even my scalp hurt. And I was like, you know what? I'm going to do another full panel on myself, even though I just did one 6 months ago. And sure enough, everything had changed. So anyway, so I went on estradiol. So with the estrogen is tricky. So when women go into menopause, there's less estrogen, so it's not feeding the uterine lining anymore. But when we do estrogen, it's like turning back time. So now the uterine lining can start building again. And with that, sometimes women experience spotting. And then they get really nervous because they're like, oh, I haven't had a period in 10 years, and now I'm having vaginal spotting. And I have to reassure them and hold their hand through this. So it's all about balance. So when you take an estradiol pellet and have it placed in you, very important, you have to also always take progesterone because progesterone counterbalances that. Estrogen builds the lining of the uterus, and progesterone helps keep it at bay so it doesn't overgrow. So I always tell women, do not skip your progesterone, or sometimes they might need a higher dose to balance it. So that's a little bit trickier. Women get nervous about that. So I think as long as I tell them that's going to happen, they're okay with it. The other thing that can happen with too much estrogen is, again, things are being stimulated that haven't seen hormones in a while. You can get a lot of breast tenderness. And for some women, they're like, whoa, like I haven't felt anything in this area for a while. It's a little almost to the point they can't put their bra on. So again, I have to warn them, but there are things that we can do about it. For example, there are supplements like DIM that can help metabolize your hormone levels to kind of bring it down and make it a little bit more tolerable. So that's the estrogen game with the women. And then sometimes I say, well, the next time we do your pellets, we'll decrease the dose a little bit. And then with the testosterone with the women, there are side effects of like hair growth, either like on the chin or on the shoulders, or a little bit of extra acne. Again, I have women do the symptom sheet. I'm like, okay, I noticed you have hair and acne. Do we want to dial down the dose of testosterone? And usual answer is no, because I feel better. I have more sex drive. I can concentrate. I have more energy. They're like, I don't care. Little few hairs I have to pluck. Forget it. So I think the key is like preparing women for the possible side. Oh, and then the other thing is when women start on testosterone, they gain a few pounds, like it could be like 5 pounds. And I would say that's like water absorption with the muscle tone. And then while the hormones are balancing out, so like the first month they come back, they're like, I don't like this. I've gained 5 pounds. I hate it. I've been working out. And I say, just you need to let things settle. And then we're adding the thyroid. And after they come back in about 4 months, they're like, okay, I'm good now. So I think,
Okay.
it's all about me educating and holding their hand and telling them what to expect.
Okay, so one of my things is how about the big letter C?
Cancer?
Yes, where I understand that, if you have past cancer issues and things like that, would you tell them to go ahead and jump on these pellets? Like, what's your concerns for you as a medical doctor? If I came in and says, well, you know what, I had a mastectomy 4 years ago. I'm feeling great. I want to jump on this.
Sure.
So,
Okay, so we know from the Women's Health Initiative that synthetic hormones, which are worse or more dangerous than bioidentical, had no causal relationship causing cancer. And bioidenticals are safer. So I say they're completely safe. And I have no problems actually starting someone. Actually, I just got asked because this woman from another provider is very interested in hormones, but she is BRCA is positive for the BRCA gene mutation, and she asked, "Are you comfortable starting them on hormones?" I go, "Absolutely. Actually, they might be protective." Um,
hmm,
because did you know that I'm digressing a little bit. Low testosterone levels in men may be indicative of a risk factor for prostate cancer.
yes.
Oh, okay. So now having enough hormones may actually put you at increased risk.
Hmm.
Um, so anyway, I would have no hesitancy, but given, people have concerns, I do always say consult your cancer doctor and run it by them. And I kind of hold my breath because it depends on the doctor and the people who have done their due diligence and educated themselves about these new updates and safety profiles may be like, no, you know,
I am so sorry, Dr. Wong. Go ahead,
um,
please.
So I am not worried about cancer in with bioidentical hormones. I feel that they're completely safe, and if anything, they could help reduce inflammation, which in turn helps decrease your risk of cancer.
Okay, great, great. So obviously you're ensuring everybody that you know through the panel test, through everything else that you'll be look at I get called, you get called, everyone's calling us. Sorry,
It's a spam.
everybody. Yeah, we tend to get hit with
We only
spams
have
a
4
lot.
minutes left in our live video.
I know I just had to reactivate my live video. It went off. So
Well, maybe
so
we could ask people if there's other topics you want to discuss. But before you go there,
well we
did
kind of
estrogen actually protects against breast cancer
okay. Okay. Do you want
and
to get
colon
into that?
cancer? No, I just wanted to put that out there. It actually helps decrease the risk of breast and colon cancer.
Okay. And listen, if we end up going off on the TikTok, you guys can go to YouTube at Security Tales and we're live on that. So it's at Security Tales and you can catch it. So now that we went through all that and we're discussing it, kind of wanted to get into supplementations and lifestyles, right? So now I want to jump on to something. I get fired up about supplements and lifestyles, and you know the amount of supplements I have. So hormones are the foundation, but the building blocks matter too.
Yes.
Okay. So that's what I kind of wanted to touch you. If you're low on these basics, even perfect hormone therapy isn't going to feel right. And that's what we were talking about in the beginning, where people that are miseducated or really are being just led down the wrong path and they don't know that you have to take certain supplementations with stuff. So, like, want to talk about creatine. Like, one of the biggest things is creatine. It isn't just for bodybuilders, it's one of the most researched supplements on the planet for women, especially during menopause. It helps preserve the muscles, supports brain energy, right? And I don't think females understand that and know that it helps with fatigue and it even helps with memory. Me personally, I recommend 3 to 5 grams a day of creatine monohydrate. Cheap, safe, and effective. It's the fuel for the muscles and your brain, right? Now, I know personally, since you've been on creatine, which I personally like the product. Yes, I've noticed jacked up, jacked up. But I like Thorne, THORNE.
ORME.
Yes. So what have you realized since you've been on the creatine?
Well, I can tell you, I'm gonna
I think
write.
you went off.
Oh, I'm gonna write. Yeah, I did. Cause well, how do I
You can
restart?
you just go live again.
Oh,
That's all I did.
okay. Sorry. It says it will end in 2 minutes.
Okay, let it keep going until it ends.
Okay, I'm just writing this down for our viewers. Thorne creatine. Well, I can tell you, everyone's been saying to me that I look more lean, and my skin feels better, and my muscle tone. I do feel like, but I've also.
No, you look great.
Thank you.
We just got a check in from India. A guy said you look pretty. So Jesus,
Cute.
huh?
But I've also.
Well, I think you look beautiful.
Thank you.
So listen, my wife's not cute. She's beautiful. Go ahead.
I've also changed some other things though. I've changed my workout routine from just cardio, which I think a lot of women tend to do because they get frustrated with that
That
middle
was
weight
question
gain.
number 7.
Oh, sorry. Anyway, um, so because I wasn't gonna say not, I did the creatine. I started adding the creatine, and I've been trying to do the 1 gram of protein per pound of weight. So if, for example, if you weigh 120 pounds, you should eat 120 grams of protein in one day.
Yes. In one day, but means split through meals,
Well,
not just, I
okay,
got
I
to do
think
120. That's it. I'm going to eat it all at first meal in the day. So
yeah. So I'm just gonna write these notations down for our patients, our
what's the
clients.
notation?
That Thorne creatine,
Yes.
hit workouts with resistance.
Well, we'll get into the workouts
okay.
later on.
Okay, I'm
Remember our
skipping ahead.
discussion where we're going to build it and lead it and not jump back and forth?
Okay.
So this way we have a track going forward. So to me, I look at it this way. If you're dealing with brain fog, creatine won't remind you why you walked in the kitchen, but at least you'll have the strength to carry the snacks back out. Okay, so you're gonna have the muscles. You're gonna have
How long
it
did it
all
take for you
burnt.
to think of that
It
one?
took me a little while. I was trying to figure out. I was ad libbing it. It kind of sucks, but hey, what can I say? So I want to discuss the core vitamins, and here are some vitamins and nutrients that I personally think women, after sitting there and speaking to you, and also adding what we were talking about. So we both know vitamin D, vitamin D3. You were talking about in D25 for bones, mood, and immunity. Okay, most of us in New England are deficient. B12. If I'm telling you to take a B12, I'm telling you to take a methylated product. It beats fatigue and protects the nerves, right?
Yes.
Now we're gonna get into magnesium glycinate, right?
Well, before we skip vitamin D.
I didn't skip it though.
Oh, okay. I wanted to add
That was the first thing that we discussed was bones, moods, and immunity.
Okay.
Okay. And most of us in New England are deficiency in it. And you said it was 30%, and we should be up at 80% or more.
Yeah. But can I add something about
Absolutely.
vitamin D3?
Absolutely.
So I just actually read a really interesting article, or it's from this book, Hormone Havoc by Terry Deneau, who is the founder of Avexapel. So she shares this story where she started a woman on estrogen pellets, and she did great her first round. Then the second round, she was like, I don't think that they're really working that much anymore. And so Terry asked the patient, are you taking all the vitamins and supplements I recommended? And she said, well, I ran on my vitamin D3 because I didn't think I needed it anymore. And so she goes, I want you to start taking your vitamin D3. We're not going to change anything else. And if you feel like that doesn't make a difference, I'll give you your money back. So the woman started taking the vitamin D3. That was the only thing different. She already had the estrogen pellet in her. And a month later, she came in and she said she felt way better like she did the first time. And that shows the importance of vitamin D3 for use in the metabolism of estrogen in our body. So even though we think like a vitamin D3 is just a supplement or a vitamin and our levels are okay at 30, it's really important to have optimal levels to make everything work well together.
Okay.
So I thought that was a pretty interesting story.
No, it was a good story.
Are you going to talk about K2 now?
I'm going down the list.
Okay.
So the next thing, that obviously the magnesium glycinate, which helps with the common anxiety, improves sleep, helps muscle recovery. Then we have, we have the zinc, which supports hormone, hair, skin, and immune levels of health. And then you have, which something we haven't discussed, which was NAD and CoQ10 for anti-aging in the mitochondrial energy and cardiovascular support. And then vitamin K.
2.
Why?
Vitamin K2 works with vitamin D to make sure that you're absorbing calcium in the correct places. So it's important. You can't just take the vitamin D. You also need K2 to help make sure that it's all working together. Vitamin D, calcium, K2.
Great. So to me,
I impressed you, didn't I?
Yes, you did. That was
I mean,
great.
I
That
know
was
I'm
great.
just a doctor,
And
but
I'll stop the nonsense. So just to revert back to it, we're going to go a little backwards here. So personally, stack those with estrogen and protein. I love how you said about 1 gram per pound of body weight. And now you're giving your body the tools you need, the tools that you need to recover, to basically help develop you back, to get that energy that you had back in the day. And your special add-ons were vitamin A, D, and K2, which is a trio, I call it. Now, here's something most people miss. It's not just about vitamin D, you just stated, right?
Yeah.
You need the trio, vitamin A, vitamin D, and vitamin K2. The D pulls calcium in, okay?
Yes.
So I kind of wanted to explain that. The K2 is the traffic cop, okay?
Ooh, I like
So
that.
what I need you to understand is this is a traffic cop that sends it into your bones instead of clogging your arteries.
Yes.
So it's going to help that conversion of it coming in to the stream, okay? And vitamin A balances the system, boosting skin, vision, all right, and immunity. Because I always hear people, well, I was just doing a probiotic or whatever, and I didn't realize it affects my vision and this and that. So people don't understand, that could be a later conversation, how things like this could affect. But that helps balance your immunity. For menopause, this is a combo. It's powerful and it protects the bone, supports the heart, health, helps with the skin dryness, keeps inflammation down. And if you're only taking vitamin D, you're missing half the team you just basically stated. You stated you need to have the trio combination for this. Okay. So anything that I missed?
K2.
Yep.
Vitamin
A, D,
vitamins A,
and
D,
K2.
D3 is the active form.
Yeah.
Because I don't even know why they sell other forms of vitamin D over the counter. And then K2.
And we call it the trio. The trio.
So can I just interject 1 second? This is my pet peeve when people come in and they say, "Oh, I take my Centrum multivitamin."
Oh God. I'm not even going to get into Centrum. So whatever.
It is not necessary to take a multivitamin. It doesn't have adequate amounts of the actual vitamins or supplements that you need. The Centrum multivitamin doesn't have it probably has a fraction of the amount of vitamin D3 that you need. I don't know.
I'm not going to, because I'm going to be honest with you, unless something gets dot tested, which is a system that they go through to test a vitamin, I'm not going to go against a vitamin, but I'm going to tell you, simple terminology is you get for what you pay for. So if you're paying $3 for a bottle or $6 for something, and then you go to something which I personally love is Now Nutrition, Thorne products. I love New Chapter. I love all these because they're dot tested, which basically means they're not heat pressed. They're tested underneath cold press, which gives you the right total amounts that your body needs. So to me, you get for what you pay for. You go to CVS, you go to Walgreens, you pick up a multivitamin. That's exactly what you're getting, a CVS and Walgreens product.
Yeah. So
nothing against you guys. Everyone's got a vitamin world. So whatever.
So in this book, I love what she says here. She goes, one study showed that up to 70% of nutrition supplements on the market in the US either don't have the stated ingredients on the label or contain harmful contaminants of some kind. And the nutraceuticals and supplements are not regulated by the FDA.
I know when I was younger and I had my vitamin store, and we used to go through a lot of things, and we used to do a lot of whey isolate proteins, casein proteins, and there was some manufacturers that came from another country, and they were cheap. I could have picked
Was it
them up.
China?
I'm not going to say where. I could have picked up a pail of 5 pounds for $4, and it was actually manufactured from a person's kitchen table. That's why it says if you have allergic shellfish, peanuts, because they're actually cutting it where they eat and mixing it and dropping the powder in, and some of it had sawdust as binders. So you get for what you pay for. So educate yourself in that field. So one of the things that you wanted to jump into was lifestyle and exercise. So, and on top of the supplements, let's talk about training. Cardio alone won't cut it. What women really need is resistant training, weights, bands, Pilates, balance work, right?
Yep.
So explain to me why, because I remember when I first met you, it was all I'm going to the gym, I'm going to do weight, and you know, now you're toner, now you're leaner, you brought all these different supplements into your system. Obviously we could see it's working for you. Your skin's changing, your hair growth, you look wonderful.
Thank
It's
you.
like you're lean, you're ripped up. So what have you personally changed in your way of training and starting to understand the proper way of educating yourself? Because like you said, I'm in menopause now. So you know you've changed. You're not that 18-year-old girl that can turn around, eat 30 burgers, go for a walk. Well, you still eat a lot. But what have you changed
well,
in
so
lifestyle and exercise?
well, first of all, thank you for saying that I look great.
Yes.
But yeah, when I first met you, I think I was just like, I'm gonna go cardio, do my elliptical treadmill for 30 minutes, and then you'd say, come do weights with me. I go, oh no, I don't want to bulk up. And I was like, well, maybe I'll do a little bit, but I was like, I'm not gonna do my lats.
You want to activate?
I don't know how.
You just go and hit live again. Sorry, everybody.
It's
We're both newbies to this TikTok stuff, so we're trying to master it.
it wouldn't turn back on.
So go ahead.
So, and I was like, no, well, there's certain things I'll do. Like I'll do my triceps, but I'm not going to do my lats or my traps because I don't want them getting huge. And then I started doing more research and realizing the importance of resistance training and more muscle training. So I've been doing more what we call, was it body workout? What is that called? Body, where you use your own body weight.
Okay.
I don't know is there a word for that?
Well, you're doing a HIIT program,
Yeah,
sometimes weighted, and sometimes just body weight workout.
Yeah, body weight workout. So I'm actually working out less. So I just do like a 20 to 30 minute HIIT or Tabata workout like 3 to 4 times a week, and then relax with cardio or stretching and yoga the other days. So it's been less intense, but I think more.
Well, it's still intense.
Oh yeah, that's true.
Because your elevation is you're getting more of a caloric burn. You're getting more of a muscle resistance, because not only instead of doing 10 reps, you're forcing yourself out for now 30 seconds, 40 seconds. So it's not really numbers anymore.
Yeah.
You're playing time. So you're doing 25 seconds, 30-second intervals.
10
less.
seconds or less. Yeah.
So that has changed. So we both know that is resistant training, because we're exhausting the receptor cells, your high and low fiber receptor cells, where you're ripping them apart. Then you're forcing them to engorge back and force blood back into them. So yeah, you've kicked up your elevation of training.
So I think, for everyone who says, oh, I don't have time. I mean, they even have 10-minute Tabata and HIIT workouts on YouTube, or just go and do that in the morning, like get up 10 minutes earlier and do that. Or if you're working from home, another great thing would be like small weights for your wrist and your ankles, like even like 2-pound weights. And I think just walking around, doing your day-to-day activity, that's going to add a little bit of resistance and help with muscle toning. I've been seeing some people wearing weighted vests. I'm not sure how I feel about that, but I think
I love them.
Yeah.
Yes.
I think it'll help also build more resistance and help prevent osteoporosis. I would say average maybe start with 10 to 12 pounds.
I would say even lower, to be honest with you. I think you need to develop a tolerance, because some people, just from us in how we structurally have been leaning forward and looking at our phones, we need to develop ourselves the proper way of gating ourselves to walk as we're doing it, because we don't want to put a vest on and all of a sudden be walking like this. We want to adapt to it. So I would say try the vest on first to make sure it's comfortable. Add 1 or 2 pounds, walk, Do it for a couple of days, then slowly add that weight
Yeah.
up and get up to that 10 pounds.
Yeah.
Don't have to run that race, but it's pretty interesting that you were discussing the workout. So I kind of went into it all, and it's simple as this to me. 10 minutes a day is all you need. 10 minutes a day, 1 minute, a warm-up, march it in place. 1 minute, one lousy minute, march it in place. 6 simple movements. I would tell you 3 sets of 15. I would tell you squats, push-ups, rows, curls, shoulder press, glute bridges. I would say a 2-minute core short planks. Most people can't do planks. Planks are incredible. If you could do them for knees, you do them for 4 to 5 minutes. I probably do them
only
20
three.
seconds.
Three. I can do 3
Well, I'm
minutes.
trying to brag for you. But it's something as simple as this. You're pushing yourself, but don't push yourself past what you can do. A 1 minute balance hold and deep breathing. One of the biggest things now that we're seeing is people, I think it's kind of funny. They're having breath classes now. I can't.
We went to a breath class.
That's what I'm saying. You made me go. It was free. But I'm going to be honest with you. I'm not paying for someone to teach me how to breathe. I've been doing it for 55 goddamn years. I think I can breathe. But for certain people,
well, actually, I was going to say for women who are in the perimenopausal period, low on progesterone, that calming hormone, box breathing super helpful, especially at night when you start to feel those palpitations coming on. So box breathing is you take a breath in and you imagine this line going up on the side of the box, and then you take another deep breath in across, and then you blow out. And that's the box. So you're doing, and it gives you something else to focus on. So breathe in, take another breath in, and then out but then you'll be taking your progesterone, so you'll be all set. But you should also practice box breathing.
Yeah, but all of this combined, right? 10 minutes to fight bone loss. Like literally, this fights bone loss.
Or wearing the vest.
Yeah, it fights bone loss.
Yeah.
It stops muscle loss. It helps with brain fog. These simple little things as we age that we negate to do. Okay? So, I just want to get towards the end and start working on a little wrap up. So here's the bottom line, right, Dr. Huang? And please interject. Menopause isn't just hot flashes, it's the whole body shift. Hormones, muscles, brain health, inflammation. You need the hormone foundation, and you need the building blocks like creatine, vitamins, and protein, right?
Mm-hmm.
So one of my questions, in the end of all this, where would people see themselves in time-wise? So I go in to see you. I say, listen, I go through all this treatment because we're getting close to wrapping up. And I just want to know, when should I see the changes of my body if I was a female and I added all this supplementation? Because I know a week later you're getting those calls and I don't feel any different. What the hell? You got me doing all this stuff and nothing's working. So people want immediate results. Is it an immediate result?
That's a good question. So it obviously depends on where you are in your life, in your hormone levels when you come to me. So if you're before menopause, perimenopausal, and you start noticing these small changes and we get you started sooner, it's going to work a lot quicker because your levels haven't declined that much. So someone who's been in menopause for 10 years, I tell them, please give it at least, 2 rounds of pellets. So at least 6 months, because you have been deficient for quite a while. I describe it like filling up a gas tank. Your gas tank is empty. We cannot top it off. If we top it off, you're going to be upset with me. You're going to be growing hair. You're going to be so I'm like, we're slowly replacing what has been lost over a decade, right? So please give it time.
So you're going a decade of dealing with all this, but yet you want 1 week to recover to that decade.
Exactly.
No, I need it now.
Yeah,
what's going on?
Yeah. And this is a natural we're replacing it with bioidentical hormones. So slow and steady.
Okay, so hormones, muscles, brain health, inflammation, you need the hormone foundation, and you need the building blocks like creatine, vitamins, and protein, which we said. And hey, ladies, all kidding aside, don't forget, you've been lifting heavy your whole lives. It's called carrying the whole family. You're already stronger than you think. So take your time, educate yourself, ask the questions that you need to be asked.
Your symptoms are real.
Yes. And Dr. Wynne, you know what? obviously my wife, I see you all the time. It's awesome having you here, and it's awesome, welcome you to my show. But please, can you give some encouragement of what, and possibly, if you're looking for fans and people to contact your office, and you can assure them that you could help them, that would be great. So please.
So I just want to make sure that I've got the message across that any woman who's feeling symptoms that you might think are a little strange, or in small symptoms even, make sure you bring these up to your provider, because they could be the start of menopause, and you're not crazy. You're not crazy. You're just, your hormones are crazy, and you're in perimenopause or menopause. And men, please be patient with your women while they go through this process and they get their help. And if you want more information, please come and see me. My website is Caring for All and Radiant Medi Spa.
Write it on the board.
Oh, okay.
Put it up there.
Put it up there.
So listen, Dr. Huang, thanks for breaking this down with me. I know so many listeners are going to walk away empowered to take charge of their health. Okay. And I appreciate the encouragement that you give, that if, they're seeking their own medical doctors and stuff, about them getting their lab works done. And people don't understand that. People are like always saying, well, Jesus, I got my blood and this is all it is. Yeah, it's not the same. You need to get your lab works. You need to ask for what specifically was just said today. So ladies, remember this. You know your body best. Thanks for tuning into Security Tales. We'll see you next time. Give a shout out to your people.
Thank you, everyone. I hope this was informative, and let us know what other topics you would like to hear about.
And the only thing that I could say is, for the people on TikTok, if you, I have some people that have written some messages. I promise you we'll get back to them, or I'll write them back to you in the instant messenger. For the ones that pick up the show afterwards on the YouTube, and if you guys got questions, please ask the questions. And I appreciate the viewer from Hartford gave us great intel and some stuff to do, and we've written back. We will answer all of them, so please just write. And if you have questions for Dr. Huang and you need, I am right here, and I can ask her for you and I can answer back. But I really appreciate the time that the ones took out today, and I appreciate the ones that will be viewing this later. I would tell you, God bless. And ladies, I'm sorry that you got handed this issue called menopause. And
but now there's hope.
There's hope, and stay strong. And guys, please, like she said, be patient. It getting rid of one relationship to get in another relationship still gonna lead to the same situation. So, because she said it was high divorce rate over menopause, it isn't worth divorce over menopause. Deal with it, guys. Grow up.
Get HRT.
Gate H, yeah. Well, I don't know.
Watch the YouTube FDA.
Once again, thank you so much, everyone. I appreciate it. Mad respect and love. Thank you so much, everybody.
Nothing beats a Jet2 holiday.